And we'll give another 2 minutes for people to join in. They're continuing to join. So I'll restart in a few. Thank you. Good afternoon, or maybe good night for some, as this has been announced around the world. I hope everyone is staying safe and healthy, and I really appreciate your interest in participating in this webinar, even though it's not about COVID. Our work needs to move on, and today I have the pleasure to introduce our speaker and a topic that really fascinates me on alcohol market and public health. What do we know and what can we do about it? And we have Dr. David Jernigan, who is a longtime colleague, friend, supporter, and fighter for alcohol policies. He is a professor of health law, policy, and management at Boston University School of Public Health. Dr. Jernigan is best known for his action research approach to the issue of alcohol advertising, marketing, promotion, and its influence on young people. His work has led to better advertising regulations and a clearer understanding of the evolving structure of the alcohol industry. His work is policy relevant, scientifically rigorous, and he has helped PAHO in many ways on this topic and others in the past 15 years. Dr. Jernigan has been very active in translating research findings into policy and practice. He testifies regularly at city, state, and U.S. national levels around alcohol advertising and youth, on alcohol availability and taxation. He also trains advocates around the world using the best evidence available and has been a consultant to WHO and PAHO on several alcohol-related topics and programs for many years. So without further delay, my pleasure, David, go on. Thank you.
Thanks so much, Maristela, and welcome to everybody. I'm looking in the attendee box, and I see many colleagues from around the world. I'm pleased to speak to you and honored to be your colleague. Just at the outset, let me remind us the breadth of the toll of alcohol, about 3 million deaths a year, the leading risk factor for death and disability among people ages 15 to 49, and a major driver of health inequalities. The same amount of alcohol will do much greater harm in a poor family, a poor community, or a poor country. And just to give you a little context, in 2016, alcohol caused more death and disability worldwide than tuberculosis, HIV, diabetes, hypertension, digestive system diseases, road traffic crashes, or violence. The risk to youth, this is US data. The earlier young people start drinking, the more likely they are to develop problems later in life. Those who start before our legal purchase age of 21 are 4 times more likely to become dependent, 6 times more likely to be in a physical fight after drinking, more than 6 times more likely to be in a motor vehicle crash, almost 5 times as likely to suffer from other unintentional injuries like drownings and falls after drinking. The primary justification for limits on alcohol marketing is the risk to young people. There's been very little research done on the risk to adults, so you'll see a lot of focus in this presentation on young people. However, the health risks among adults from alcohol are considerable. Here in the US, we have witnessed an unprecedented decline in the life expectancy of middle-aged non-Hispanic white people, and this is coming from poisoning and overdose, of which alcohol plays a substantial role. It's coming from suicide, 23% of those are attributable to alcohol use, and it's coming from liver cirrhosis. More than 50% of the cases of that are caused by alcohol. So alcohol marketing, it's important to understand that modern alcoholic beverages are of their essence marketed beverages. This is an industry that relies on marketing. It is selling the image at least as much as it's selling the product. The purposes of marketing in any marketing class in business school will tell you it's to promote brand switching among existing brands, to protect market share from competitors, to inform the public of new products, and to attract new users. Now, there are two industries who claim that their marketing does not include the last one that's in red. Those two industries are tobacco and alcohol. Marketing is a large, why am I going the wrong way? Okay. Marketing is encompasses a broad range of activities, and it's important to understand how the breadth of marketing, including stakeholder marketing, corporate social responsibility, and so on. In this presentation, though, I am going to focus primarily on that inner circle, the traditional, what we traditionally have understood to be marketing in the mass media. This marketing is incredibly expensive. And the industry can afford to do this because it is so consolidated. Worldwide, alcohol is about a $1.5 trillion a year business. And in terms of beer companies, the 10 largest beer companies sell 2/3 of the world's beer, spirits. 10 companies sell more than 50% of the world's distilled spirits. Just looking at the level of consolidation, you can see that 10 companies are responsible for 35%, a third of total retail sales of alcohol worldwide. If their revenues were combined, these 10 companies would be the 54th largest economy in the world. As an industry, alcohol is the 8th most profitable industry in the US, 21st most profitable in the world, more profitable than pharmaceuticals or soda pop. And the key to their dominance and their profitability is marketing. Anheuser-Busch InBev, I don't understand why the slides keep moving. I'm not doing anything.
They were moving backwards instead of to the front.
Dr. Jernigan, can you tell me what slides are you in, and I will move. You just asked me to do the next.
Sure. I'm currently on slide number 9. Go back 1. That's 10. Thank you. Okay. Anheuser-Busch is the world's 9th highest spending advertiser. They spend more to advertise than Coca-Cola, Toyota, General Motors, or Ford. And at the country level, they're among the largest advertisers, particularly in low and middle income countries. Next slide. Marketing plays a key role for the industry nationally and globally. It functions as what economists call a significant barrier to entry. Anheuser-Busch InBev's cost of advertising per barrel sold is significantly lower than its competitors, and the same is likely true of Diageo. There are just enormous economies of scale. With this barrier to entry, then it keeps new firms out. This helps to maintain the oligopoly and the oligopoly profits of the industry, which in turn support more marketing spending. So, and part of the point of this marketing spending is to counter the increasingly bad news about alcohol and health. Next slide. So as I said, Anheuser-Busch, the 9th largest marketer in the world. They spent over $6 billion globally in 2017. And much of that spending is increasingly going to social media. They spent $595 million on traditional measured media and almost double that in other channels. This includes entertainment, sports sponsorship, but a substantial portion of that is also going to digital and social media. Next slide. So here are some examples from alcohol marketing around the world. The top picture is from Chile. Those are children wearing t-shirts advertising the most popular beer in Chile. The bottom slide is a picture I took in the Philippines. That is a billboard located across the road from a church and a school, and it says, "So good you'll get hooked." Next slide. This is a playground, a billboard next to a playground in Philadelphia. Next slide. This is advertising on the exterior of windows. We just published a study in Baltimore that looked at presence of this advertising and found that presence of this advertising was associated with greater risk of violence in the proximity of these outlets, even when we controlled for all sorts of other things. Next slide. Yeah, this is another similar slide, and this is actually from Baltimore where we did this study. Next slide. Again, outlets covered in advertising for the product, much of it price advertising, and this is part of why outlet density is such a problem. Next slide. But let's move to digital and social media. So first, a quick look at Facebook. So here is from one of my least favorite products, Four Loko. This is a supersized alcohol. It comes in a 22.5-ounce can containing 14% alcohol. That is close to the amount of alcohol in a six-pack of beer sold as a single serving. And yet they're putting out something that says, if this isn't you after Thanksgiving, you're doing it wrong. Next slide. Another one from Fireball Whiskey. I'm still hungover from last night, and the only cure is more Fireball. This is clearly promoting a dependent drinking, problematic drinking. Next slide. On Instagram, next slide, we have all sorts of associations of alcohol with beautiful young women. Next slide. Advertising in conjunction with major music festivals. Next slide. Advertising, again, beautiful women. Miss Universe loves Cointreau. Next slide. And then Toddy Smith, he's an Instagram star. He started building his online following when he was 19. He's now 26. He has more than 2 million Instagram followers and more than 1 million subscribers to his YouTube channel. And he's a promoter for Mike's Hard Lemonade. Next slide. Here's DJ Khaled, and DJ Khaled actually reportedly doesn't drink, but had a big promotional contract with Ciroc and got into a lot of trouble for it because, as it turns out, they were not identifying that he'd been paid to promote the product, which is a violation of Federal Trade Commission standards here in the US. Next slide. And DJ Khaled is not alone. A study by Vic Health in Melbourne, Australia, released last year, looked at the top 70 Australian Instagram influencers and their alcohol-related content. 73% of them featured alcohol brands in their Instagram accounts in the last year, and 39% of these were undisclosed. That is, they did not feature a hashtag showing it was sponsored or an ad or collaboration or use the paid partnership option available to them on Instagram. Next slide. Next slide. Thanks. On Twitter, obviously the brands are actively using Twitter, rocking that millennial pink from Bacardi. Next slide. Promoting music and powerful women, so interesting in alcohol advertising. The ads that target women show women as incredibly powerful. The ads target men invariably show women as what a man can get when he drinks. Next slide. Who's ready for a pun at the Budweiser USA Country Club? Wait to see what you have in store for you. Next slide. And then this came from Four Loko. Again, this one hits home. They are retweeting something that was created by a user, and I actually was so outraged by this one that I complained to the General Counsel of the Beer Institute, who brought it to the attention of Four Loko, who expressed their shock. I got a very nice letter saying they'd had a new person monitoring their feed, and that clearly that new person needed more training. Next slide. On Snapchat, Diageo got into a lot of trouble for using this ghost on Snapchat into which young people could put their own faces. And as a result, Diageo pulled all of its advertising from Snapchat, but plenty of other alcohol brands are still there. Next slide. On YouTube, next slide. The viewership of popular alcohol ads on YouTube is in the tens of millions. These are longer than the ads can be, and they are often showing things, doing things that you couldn't do in a regular televised advertisement. It's also theorized in the advertising world that these are more influential because they are pull media. That is, you have to go looking for them, so it's assumed that viewers will pay more attention to them. Next slide. What do we know about exposure to these ads on YouTube? Well, we do know that from an assessment of the 16 brands that were associated with the highest underage past 30-day prevalence of drinking those brands, a group of researchers created fake profiles with YouTube ages of 14, 17, and 19. YouTube has a policy that if your YouTube age is under 21 in the US, you should not be able to see the branded channels where these ads are. However, every one of the profiles was able to subscribe to the 16 brand channels, and on average, 2/3 of the brand's channels were successfully viewed by those dummy profiles. Next slide. We did a pilot survey in 2013 of youth and adults through an internet panel to look at exposure to alcohol marketing in various media. Next slide. Next slide. And what we found is, particularly on the internet, young people were reporting twice the exposure of adults. Next slide. Also significantly more likely to have seen alcohol ads on the internet, to have seen celebrities using alcohol, and to have seen celebrities wearing alcohol branded items. Again, Instagram is one of the main places where this happens. Next slide. And then in terms of interacting with these, young people more likely, adults more likely to interact. Young people more likely to interact with celebrities and also with friends and peers. Next slide. Now, many of these young people were underage. How could it be possible that they were getting access to these? Well, we also asked the young people how often they had lied about their age on the internet. And no surprise, the younger the age group, the more likely they were to have lied about their age. These voluntary, be honest efforts to keep young people away from this kind of marketing clearly are ineffective. Next slide. What do we know from the studies of alcohol marketing in youth? The first summary looked at 13 longitudinal studies that followed groups of young people over time, monitoring the exposure to alcohol marketing and their drinking behavior. Those studies found that the more young people are exposed, the more likely they were to start drinking or, if already drinking, to drink more. Next slide. The latest, we did another systematic review published in 2017, 12 more studies, 9 unique cohorts. Again, significant associations, particularly strong associations with progression from experimentation with drinking to binge and heavier drinking. So the bottom line is that alcohol marketing appears to be a major risk factor for underage drinking. These studies have been done in a variety of media. We are not nearly catching up with what the industry is doing in social media. Next slide. In 2011, we did the only survey that's ever been done in the US of young people's consumption by brand. And we used this to refute some common myths. Do young people drink the same brands of adults? No. Do they drink the cheapest brands? No. Do they drink the brands that are easiest for them to obtain? No. In fact, young people drink the good stuff even when they're stealing it from their parents' liquor cabinet. And how do they know what the good stuff is? Alcohol marketing. We were also able to associate brand and type of alcohol with consequences. 8 specific brands were heavily associated with a greater likelihood to experience fights in industries, and kids drinking those supersized alcohol pops in particular, 6 times more likely to suffer injuries. We also looked at their exposure. Kids with reported exposure to a brand's advertising were 3 times more likely to drink that brand. Using the Nielsen data, population level exposure among young people was associated with a 5 times greater likelihood of young people consuming those brands. Next slide. So how does this work? This is from the group at Dartmouth Medical School that's been studying alcohol marketing, and what they have hypothesized is that there's a progression that happens, that young people are exposed and start noticing marketing just when they're starting to build their norms about drinking and their expectations for what's going to happen when they drink. As they start to remember and recognize the marketing and like it, they develop a drinker identity, and they start a progression towards problem drinking. This progression then continues through their interactive participation with marketing, their allegiance to a particular brand, and their communication of preferences to their brands, and then, of course, the marketer's dream, their own generation of marketing messages through social media channels. Next slide. So here's another analysis of how the effect actually works. And this group measured a variety of exposures, from videos on the internet showing someone drunk and high, to pictures and comments on social networking sites, movies showing someone drunk or high, TV programs showing someone drunk or high, alcohol ads on billboards in magazines or somewhere else, songs talking about getting drunk or high, and video games showing someone getting drunk or high. Next slide. What they found is greater exposure to substance-related media increased young people's normative beliefs about pure alcohol use, which then predicted greater alcohol use during adolescence. So what's happening is that media, and in particular social media, are functioning as a super peer in young people's minds. They are loaded with alcohol marketing. The implications for action here is, a huge need for media literacy, but also for effective public policies that can limit some of this exposure. Next slide. So this is a video, and we've sent out the links for it. We weren't able to make the videos play. This is an amazing video from Jay-Z for Budweiser that ends with the tagline, "We are all living out our dream." It never mentions drinking Budweiser, but after he says that, there's a big shot of the Budweiser logo in front of it. It's okay, we can go back to the slide presentation. We can go back to the slides. We can go back to the slides. We are sending out the links to these videos, and so participants can play them later. Next slide. The main way that this advertising is regulated is through the industry's own self-regulation. I like to say that that is not only the fox minding the chicken coop, it's the fox building the chicken coop. So just a couple of examples. One of the Beer Institute code guidelines in the U.S. is that marketing should not portray beer drinking before or during activities which for safety reasons require a high degree of alertness or coordination. This is an advertising that shows young people doing flips, doing high jumps, etc., all sorts of things on skis and snowboards. And you can't see it. They give you a hashtag to go to in the ad. If you go to that hashtag, then you can see that they're actually holding Dale's Pale Ale, an alcohol product, in their hands as they do these. The ad itself says, legally, we're not allowed to show you everything that's happening here. It's a very cute, tongue-in-cheek, making fun of the guideline. Next slide. This is not supposed to appeal to individuals below legal purchase age, and yet this is a quote from the famous children's author, Dr. Seuss, "Why fit in when you were born to stand out?" Next slide. I could show you examples all morning long, all afternoon long, but I don't need to. There is a review of the studies of alcohol industry self-regulation, more than 100 articles from multiple countries. The bottom line is there have been no studies of this self-regulation that have found it to be effective, either in governing youth exposure or in guarding against potentially harmful content. Next slide. Case study of that was a look at what happened in the World Cup in 2014, where a majority of the ads presented alcohol as necessary for social success, as a means of removing social sexual inhibitions, as a stimulant, sedative, or tranquilizer, or as a method to enhance physical, sporting, or mental ability. Next slide. In terms of other media, again, Dartmouth Medical School has coders who look at the top 100 box office hits in terms of movies. They looked at 1,400 movies from 1996 to 2009. They initially started doing this to monitor tobacco brand appearances, but there are so many more alcohol. They found 500 tobacco brands, but 2,433 alcohol brand appearances. Go to the next slide. And you can see this is what happened in terms of alcohol brand appearances over time. And next slide. And this is what happened to, that was tobacco, and this is alcohol brand placements. The brand placements increasing, and the increase happening particularly in G and PG rated movies. Those are the movies that are deemed acceptable for young people to watch here in the US. Next slide. Other media, my colleague Mike Siegel has looked at popular music. 38% of the most popular urban songs mention alcohol, 22% of country songs, and again, specific brands showing up in the songs. Next slide. So there is clearly this relationship. We find it longitudinally. We find lots of youth exposure. But is the relationship causal? Is exposure causing young people to drink more? The Bradford Hill criteria are the standard criteria in alcohol epidemiology for assessing causal relationships between environmental factors and disease. And this just came out in March. Jim Sargent and Tom Baber looked at the literature about alcohol marketing in young people and went down all of these criteria. These are the Bradford Hill criteria for causality, based on the strength of the association, based on the fact that the studies find a dose-response relationship, that the cause precedes the effect, that the finding's been consistent across locations, populations, and circumstances, that it is very specific. One type of exposure to alcohol marketing leads to one specific outcome, more youth drinking. It is certainly psychologically plausible. There is evidence from experiments that have been done with young people as well. It is a coherent body of evidence. That is, there are no studies that have found that the greater youth exposure is the less they drink. And there's a powerful analogy in that it's very similar to findings on tobacco marketing. Based on these, Sargent and Baber conclude that this is indeed a causal relationship. Next slide. In this period, in the age of COVID, there is a certain transformation happening in terms of alcohol marketing, at least in the country where I live. Marcel Marcondes, who is the Anheuser-Busch InBev Chief Marketing Officer for the US, was recently quoted as saying, "I think now, if there's still someone doing marketing and doing self-serving campaigns, these times are officially over and officially gone." In this period, no, go back, please. Thanks. In this period, Anheuser-Busch said it has shifted its sports and entertainment spending to corporate social responsibility activities, converting breweries to produce hand sanitizer for healthcare workers, devoting millions of dollars to the Red Cross to convert stadiums into blood drive donation centers, creating an open for takeout online app, which 160,000 bars and restaurants have subscribed to help people find what outlets are open in their zip code, promoting student loan relief under the Natural Light brand, sponsoring streaming workouts under the Michelob Light brand, and then donating $100,000 to individual women who are helping their local communities during the pandemic, partnering with UN Women to do that under the Bon Vive Spiked Seltzer brand. Next slide. All of this is happening with no attention and no information to the role of alcohol in this particular virus. It is well established that alcohol suppresses multiple aspects of the body's immune system response, with particular effects on the lungs' ability to fight off infection. In the short term, what we're seeing, at least in the US, is that off-premise sales, sales not in bars and restaurants, have risen incredibly. And these have been accompanied by an increase in police calls for domestic violence and emergency room presentations of child abuse. In the longer term, also, people are putting in place now patterns of unhealthy coping, which will eventually get them into trouble. Studies that have been done of the aftermath of the SARS epidemic, the World Trade Center disaster, and the hurricanes Katrina and Rita all show increases in alcohol use disorders and or youth drinking 1 to 2 years after the event, with the risk of a use disorder or increased drinking rising based on an individual's proximity to the event, whether they were a frontline worker, whether they were quarantined, and so on. So alcohol is playing a real role in this epidemic. It's not something that the industry's marketing is going to tell you anything about. Next slide. And this is an amazing ad, which I can't play, but I encourage you to play it on your own. It's basically Anheuser-Busch's gift card to the first responders. It shows nurses and EMT personnel and all sorts of other people, because it's very much trying to position the industry as being on the side of all that is good and all the things that people are trying to do. Again, with no basic information that one of the worst things you could do to prevent yourself, to keep yourself, one of the most harmful things you can do in terms of preventing yourself from contracting this virus or suffering from it is to drink, and in particular to drink heavily. Next slide. So what are the policy options here? What can we do? And around the world, we see all of these. In some places, there's virtually no regulation. In much of the world, it's primarily industry self-regulation. In some places, it's self-regulation combined with government regulation. We see a variety of partial bans of alcohol marketing. And then there are some places where we see total bans. Next slide. A total ban is by far the easiest to implement. It's the least expensive to implement. The research base supporting total bans is not extensive because most of the natural experiments, the situations where we could evaluate what was happening with marketing and consumption, are all in the other direction. They're all around increasing marketing and increasing consumption. And bans will generate significant alcohol industry opposition, as our Lithuanian colleagues can tell you, as our South African colleagues can tell you. The industry will claim that this is going to hurt competition. It's going to make it harder for new products and new firms to get into the market, when in fact, as I said earlier, the current high spending on marketing actually creates high barriers to entry that hurt competition. Next slide. Partial bans can occur in a variety of different forms. They can be specific to content. These tend to be very difficult to enforce. Nonetheless, there are lots of places that have them in statute. They can be time specific. For instance, time watersheds. These are tricky because, at least in some cultures, there are more young people watching video late at night than adults. So a time watershed can sometimes backfire. They can be audience specific, trying to keep it away from young audiences. Beverage specific, it's very common, for instance, for countries to ban spirits advertising more so than beer and wine. Medium or channel specific. They can be location specific, no marketing, for instance, at sporting events on beaches, and that blurs over into event specific. Again, the research base is not as broad as it is for physical availability, limiting physical availability of alcohol or taxing alcohol, but the clearest research case is that marketing exposure has a causal relationship to youth drinking. Next slide. WHO's global strategy, which has been in effect since 2010, has encouraged legislatively based, statutorily based regulatory or co-regulatory frameworks that take on content, volume, sponsorship, and new marketing forms, as well as the development by public agencies or independent bodies of effective systems of surveillance of marketing of alcohol products. Surveillance is critical here because the industry is everywhere and is so innovative. Way back in 2012, Diageo sent 800 of its staff to Facebook boot camp to teach them how to use that platform. I think many of us wish we had 800 staff to do anything, never mind 800 people who could learn how to use Facebook to more effectively market alcohol. And then setting up effective administrative and deterrent systems for infringements on marketing restrictions. If there are no real penalties for violations of the restrictions, there's very little incentive. If the penalties are small, the industry will simply absorb them as part of the cost of doing business. Next slide. A technical group brought together by the Pan American Health Organization a couple of years ago laid out principles for regulation of alcohol marketing. These include, first, that the most effective way of reducing the risk of exposure to alcohol marketing for those most in need of protection is a comprehensive, legally binding ban. From a public health standpoint, there's no rationale for applying different regulations to alcoholic beverages of varying alcohol content. Regulatory capacity to do this kind of regulation is an essential public health function and should be addressed in legislative measures and in the allocation of resources. And cross-border alcohol marketing should be subjected to the same regulatory measures as those applied to marketing originating from within a state. In practice, go back again. In practice, this last one is very difficult to do, and it's part of why the executive board at the World Health Organization has commissioned a major report on cross-border marketing of alcohol. This is one of the most difficult things for an individual country to regulate and is part of the argument for the need for a stronger global approach to alcohol marketing, which I'll talk about in a minute. Next slide. There are all sorts of opportunities for civil society groups not affiliated with the alcohol industry to participate in developing, supporting, and monitoring effective regulation of alcohol marketing, particularly if they're given a clear mandate and resources for doing so. The model here is France, where if an NGO brings a successful complaint, the NGO receives the fine that the industry is required to pay. Number F is similar to a line in the Framework Convention on Tobacco Control, just recognizing that the alcohol industry has such a vested interest in marketing that it should not be part of setting public health policies with respect to alcohol marketing. And then finally, multilateral and bilateral trade agreements should protect national and subnational regulations about marketing, or explicit provisions should be written into those agreements, as opposed to what has been too often the case, which is that those agreements undermine national efforts to regulate marketing. Next slide. The trend in statutory regulation is somewhat in a better direction, but very, very slow. Next slide. And the trend similarly in restrictiveness of policies, these are from 144 reporting countries for the last global survey on alcohol and health. And you can see things are moving in a slightly more restrictive direction, but they're moving very slowly. And there's almost no movement on regulation of alcohol marketing in social media. Next slide. And this just makes that point. Very little movement on regulation of new marketing, including digital and social media. Next slide. Russia is a very interesting case study here in that Russia recognized it had a huge alcohol problem. The dotted line there is alcohol consumption. The dark line is life expectancy. Russia has made major gains in life expectancy at the same time that it has significantly depressed alcohol consumption. Next slide. One of the ways that it has done that has been to increasingly regulate and restrict more and more alcohol marketing, whether that is on the internet or in electronic media or in sporting or on television. Next slide. And then this is just a timeline of all the different things, including marketing regulations, that Russia has done over the past 20 years to get them to where they are today. Next slide. Other alcohol bans. Lithuania finally was able to implement a complete ban of alcohol advertising in January 2018. Norway and Sweden have a long-standing ban on alcohol ads on television. In Bulgaria, Finland, Latvia, Poland, Spain, Slovakia, and Romania, they don't allow spirits advertising on television. Finland has banned games, lotteries, contests, and sharing or efforts to promote sharing in digital and social media. This was an effort to reduce the impact of alcohol marketing in social media. Early evaluations of that suggest that it is the exposure more than what happens when youth are exposed that is still a risk factor. So bottom line is the Finnish experiment may not be enough to reduce the influence of social media on young people's drinking. Next slide. Counter-advertising was very successful in tobacco, and it's very little used in alcohol. True counter ads actually take on the legitimacy of the advertising industry itself. And in the US, the Institute of Medicine in 2003 called for many experiments in youth-oriented media campaigns. None were ever funded in this country. Next slide. We were able to do a small experiment with young people in Baltimore City here in Maryland in the US. Where the young people chose to do a counter ad series on this particular product. This is Pabst Blast, which is a strong alcohol product with the tagline "Works every time," and the spokesperson Snoop Dogg. Next slide. And this is what the young people came up with. They used the same typeface and the same tagline. They created their own product. Barf beer, beer and alcohol ruin futures. There was no money behind this. They put it on some posters, backpacks, stickers, pins, and so on. They learned a lot about alcohol marketing, but there's huge potential there. Next slide. The bottom line from the research is that young people are vulnerable to influence. The primary way they're protected is through industry self-regulation, and those codes are routinely violated. Next slide. What marketing tries to do is embed alcohol in the target audience's life, make it affordable, use new products to catch new audience, and put the products in places where the audience can easily get it. Next slide. And if we're going to address the entirety of the marketing mix, then we need to be looking at product and price and place, but we also need to look at the key role that promotion is playing. And frankly, banning whatever can be banned is probably the most effective approach. Next slide. In social media, what is critical is to address the platforms. Much of this is happening in private spaces. In the US, we have given our democracy away to unregulated, highly profitable giants. Some of us have been in conversation with Facebook. Facebook reaches out periodically to us with questions like, should we be allowing alcohol promotion at all on our post platform? And you can guess what I and my colleagues are telling them. But there are also local powers to address other aspects of marketing, whether it's banning alcohol outdoor advertising, retail advertising, and so on. Next slide. But the digital and social media are global platforms, and global action is needed. So next slide. Next slide. Next slide. WHO has put forward the SAFER package. This is an excellent package of evidence-based interventions, including with the E, enforcing bans and comprehensive restrictions on alcohol advertising, sponsorship, and promotion. Next slide. But many of us are increasingly talking about the need for a framework convention on alcohol control. The model is the Global Framework Convention on Tobacco Control, signed by 168 countries. It sets a floor for national action on tobacco control. Countries can do more, but this treaty sets the minimum. And as a global treaty, it has the ability to address global and cross-border actions and could be a vehicle for limiting alcohol marketing in social media. Next slide. The rest of it is up to us. Never doubt that a small group of thoughtful, committed citizens can change the world. According to the attendee box I have open here, there are 135 of us attending this webinar right now. I hope it's been useful to you, and I think we have a little bit of time left for questions. Thank you.
Thank you very much. This was an outstanding presentation, as you always are able to do. And we'll open the floor for questions. If people cannot speak or be heard, they can chat, and we'll present the question to David. Bruno Hellman, go ahead. Unmute your microphone.
We still can't hear you. And we still can't hear you.
Yeah. I don't know if he's trying. Bruno Hellman?
We have a question. I'm curious about articles about youth drinking post the pandemic and natural disasters. And so Jürgen Rahm's group at Center for Addictions and Mental Health in Toronto led a systematic review of the literature on this, and that will come out. A commentary using those results will come out in Drug and Alcohol Review later this month or in early May. A bunch of us are co-authors on that. So that's one place to look. I summarize some of it and provide a bunch of links in an article I wrote for theconversation.com that was published on their website last week. If you go to if you go to theconversation, all one word, .com, and search my last name, it'll come right up. So are there any examples of countries with liberal governments that have adopted? Well, yes. I mean, Lithuania is a democracy. I'm not sure what you mean by liberal. If you mean neoliberal, then no, because alcohol marketing flies in the way of neoliberalism. But many of us would argue that neoliberalism is declining in its influence, particularly in the wake of the current pandemic. I am always an optimist.
Can you see the other questions? What about mocktails?
Mocktails. This is such a good question. And this often happens in places where a ban is in place. The industry will market mocktails, but they'll also market line extensions, other products that carry the logo, whether they're alcoholic or not. My view of that, and this is my opinion, is that those are alcohol marketing, and that a comprehensive ban would ban the extension of the brand into non-alcoholic products as well, because that's the whole point.
There is from Francois Danhous, in view of the WHO EB to reject a proposal to study the feasibility of a framework convention on alcohol control, what would you suggest would be the next steps to make this happen?
Yeah, that's a great question, and one that many of us are thinking about. The minimum is that we have to keep the pressure on. If you look back at the development of the Framework Convention on Tobacco Control, it took years. An alcohol convention is going to take years. We made some progress. We certainly got alcohol higher on the agenda of the executive board than was originally planned. We're incredibly grateful to countries like Thailand that took the lead this year. And we simply have to keep the pressure on.
And Mike from Movendi wanted to speak before. Do you still want to make a question? You can unmute and ask.
Mike, we can't hear you.
I'm unable to unmute him either. Anna, can you try to help us?
Yes.
All right, good. I hear you.
There he is.
Thank you, Maristela. David, thank you for your excellent presentation. You had one piece of information that was standing out to me, and that was that UN Women is now partnering with AB InBev and this Bon Vivre
Yes.
in the COVID-19 response. I was Googling now, trying to find it. Could you explain more or share a link, please? That was quite remarkable. Thank you.
Sure. I'm happy to share a link. It was reported by Just Drinks, which is one of the industry news firms that I subscribe to for a mere $600 a year. But I'm happy to send that to you afterwards. They reported it along with, as the slide showed, a bunch of other corporate social responsibility actions that Anheuser-Busch InBev was taking in the wake of the COVID-19 epidemic.
We have from David Oren.
I can't hear anything.
Yeah. Oh, now I think he'll talk. David?
Yeah, can you hear me?
Yes.
Yes.
Okay. So I'm interested in what you have to say about the effect of the alcohol industry on public health. But I'm not sure that I agree that your approach, which you're recommending, is actually to deny people the right to drink alcohol in a number of, or a variety of ways, which I think is what you're pointing towards. I have a different question, which is this. Given the science and our understanding of the good things that alcohol does do for us, disinhibition, a level of relaxation, the opportunity to more easily communicate, form community, interact, have social exchange, something that we've done as humans for so long. And given how we've developed our understanding of this and so many opportunities that exist with both synthetic products and with natural products, should we not be putting efforts into promoting alternatives and supporting the obvious desire and curiosity, which is almost relentless, that young people have to find a better way? You know, my kids are now no longer kids, they're 20. And they are really curious about what they drink and eat. And I think we've been really successful at finding other ways to gain, to live healthy lives. I think the idea of simply using legislation to deny individuals access to something that actually plays an important role in our society, to me that just seems short-sighted and likely to allow alcohol companies to position such an effort as being dictatorial, undemocratic, infringement, etc., etc. Aren't there ways we can promote alternatives that are actually good for people, that and that allow people to make their own intelligent decisions about what they consume?
Thank you for the question. That is a commonly expressed viewpoint, and I would be more in support of it if the research literature supported it, but those alternative ways have not been particularly effective. We're not talking about denying anyone's quote-unquote right to drink. Numerous countries have legislated that young people should not drink, and that is a social choice by those societies. The literature on the effects of alcohol, in particular on the young developing brain, before arguably young people are cognitively ready to make fully informed choices about things like drinking alcohol, suggests that limiting access to alcohol to young people is a wise and scientifically based step to take. There are lots of things that we have done as humans over centuries that we no longer do. We have better evidence at this point of the harms from alcohol use than we have ever had before. But the problem is that we have a highly imbalanced information environment about alcohol. With the billions of dollars that go into alcohol marketing every year, it is very, very difficult to get health messages out. So I would argue that, in fact, it is a democratic act to limit the speech of the alcoholic beverage industry, which has a clear financial vested interest in promoting their product, and instead to promote a more balanced information environment where people can make intelligent choices. However, intelligent choices require accurate information. Alcohol marketing does not provide balanced, or I would argue particularly accurate, information about alcohol and human health.
We have one more question here from Andrea Friedel.
Yes.
Isn't
greater taxation the most effective regulatory intervention? Given the choice, wouldn't it make more sense to encourage governments to increase taxes on alcoholic beverages? Absolutely, and I wouldn't argue that it's an either or. I think both taxes and limits or restrictions on alcohol marketing are part of the WHO safer package. Taxes can be incredibly effective in discouraging consumption, particularly among young people who are more price sensitive, in some cases than adults, because they have less money. And there's a very solid research literature behind that. At the same time, the marketing helps to promote an environment that makes it more difficult to pass things like taxes. Among other things, marketing gives everyone the impression that everyone else is drinking. And this is particularly interesting to watch in a country like my own, where in the past 30 days, only 56% of adults 18 and above had an alcoholic beverage. And yet you ask almost any adult, and they will say upwards of 80 to 90% of Americans are regular drinkers. It's simply not true. It creates a normative climate that supports drinking, that positions drinking as an essential part of practically every part of human lives and undercuts the ability to implement effective alcohol policies such as higher taxes.
One more, given the facts as presented on the powerful impact of marketing on alcohol use, what are government's general position on marketing of alcohol? Are they generally interested in engaging the problem head on? Can you speak to some of your successes in selected areas, countries, in getting marketing reduced or eliminated?
Yeah, interestingly, I think we've had the most success recently in some of the countries of the European region. There's a lively debate continuing to go on in South Africa. You know, there is something of a trend towards more restriction over alcohol marketing, as I showed in the slides. I tried to highlight the countries in the slides where things have been moving.
All right. Finally, if you have any data from the Caribbean countries, with that, we'll have to close the session.
Yeah, you know, to my knowledge, there have not been studies done of this in the Caribbean countries. We certainly have plenty of examples of alcohol marketing in the Caribbean countries, and there is always a need for more research to promote this as a policy conversation. The trade and economic benefits of alcohol are highly promoted throughout the Caribbean, and much less well-known and well-publicized are the public health and safety costs.
All right, with that, we'll close this session. Just as a comment, it's interesting now that during the pandemic, several countries have prohibited alcohol sales in the Caribbean. So it will be interesting if there is data later on to assess the impact separately from all the other economic impacts from closures, for example. And
yes, and South Africa is another example there where the liquor sales have been drastically curtailed, and the emergency department staff are blown away by the degree to which use of their facilities has dropped in the wake of alcohol sales being limited.
Yes, and so there is much to do still, and to research, and I hope the opportunity set as it is that we are going through right now is also a chance to study many aspects of alcohol control, alcohol availability that can have help clarify what issues in many countries that for which we have no data before. So I want to thank you very much for this excellent presentation. The recording will be available and the presentation as well very soon, maybe tonight or tomorrow, and we'll send to everyone who registered. And thank you again, David. You're great.
Thanks for having me.
Bye-bye.